My name is Gerard Wainwright, and I was fortunate enough to receive a Queen's Nursing Institute Innovation Award in 2020. The award included funding of £5,000 to help support the Unsafe Swallow project, to address health inequalities for people with learning disabilities who have swallowing risks. At the time, some of my colleagues and other people I work alongside were sceptical about the budget, saying that you can't do very much with that amount of money. But the funding is only part of the story. The support and guidance provided by the Queen's Nursing Institute to make your vision a reality is much more important than the money that is made available. To me, this was the true significance of the QNI Innovation Award. It opened a door to opportunities I otherwise would not have had access to. This included networking with a range of other project leads and organisations, support and encouragement from a business manager who helped translate my vision for the project into a viable, sustainable and cost-effective plan. But most of all, it gave me the belief in the project and myself to make my idea a reality. Without the QNI's backing, I would not have been able to achieve what I have. The QNI have 30 years experience of giving innovation awards. That's over 300 projects. They were very clear that innovation projects should start small, be sustainable, and grow and develop. As the pandemic started around the same time the projects were due to begin, we had to be very innovative about how we would go forward with our plans, which centred around health promotion through face-to-face training. What started as a challenge, we were able to turn to our advantage. Virtual teaching sessions were introduced, and we were able to work with more widespread services in different parts of the country. There was no need to book expensive training venues or spend time and money travelling to different places. Suddenly, the potential of the £5,000 funding seemed far greater. We were able to make the most of technology, using a webinar-based approach and creating videos to support health promotion seemed like a good solution to reach a much wider audience and really get the message out there. What was initially a challenge was used to our advantage and ultimately became a strength. Our original project was very much aimed at promoting a greater awareness of the risks of swallowing difficulties for people with learning disabilities. We identified this as a significant health inequality. The aim of the project was to identify people working with adults with learning disabilities who have swallowing risks, people with learning disabilities themselves and their families, to provide them with the knowledge, skills and confidence to recognise when someone has an unsafe swallow, to identify ways of reducing risks to the person's health, to know who to refer to work alongside the right health professionals to get the right help at the right time, to help reduce the chances of people with learning disabilities becoming unwell because of an unsafe swallow, and in some cases dying because of this. Collaboration was very important. The initial idea for the project came from one of our clients who had swallowing difficulties and wanted to share his story. We worked with speech and language colleagues, learning and development, and one of our client advocates who was a driving force and whose passion for the project helped inspire and motivate us to continually adapt and develop. As the project grew, it became clear that postural care is important to all aspects of health for people with learning and physical disabilities, not just swallowing difficulties. We used some of our funding to commission a series of virtual events with Simple Stuff Works. This practice is now embedded in many of our services. We also set up a group looking at how we could embed the PMLD Core and Essential Standards into our practice. This has since led to us setting up the PMLD network, which now has over 40 members throughout the UK. We started a project on the benefits of accessible nature for people with learning disabilities, for sensory engagement and mental health benefits. For anyone considering investing money in a QNI Innovation Award, I would say the potential benefit to your project leads, organisation, CPD and wider impact is enormous. Since starting the Unsafe Swallow project, there have been over 270 views for the initial video, which forms part of the webinar training. Some of these events have 20 or more attendees, so you start to see the potential audience, which continues to grow. The video training resources which were developed have a much larger reach. The ripple effect of these projects can be extremely influential. Although it's over a year since we started the project, and the award itself has come to an end, the momentum continues to build, and the project is going from strength to strength. The project has been showcased at a recent PMLD conference with over 500 delegates. It's featured in articles in the PMLD Link and Learning Disabilities in Practice. It's been picked up by NHS trusts, the RCN, speech and language therapy colleagues and SEN schools, as well as learning disability groups such as Lead the Way. It's true to say the initial project has grown and developed beyond all expectations. It's easy to put all our focus on financial budgets. We all work within restrictions, and it can feel like we're expected to increasingly provide more for less. To put £5,000 into context, that would provide agency cover for 20 night shifts, less than 3 weeks. But more important than the value for money is the human value in these projects. Admittedly, I've invested a lot of my time into the project, as have the other people involved. But for me, it's been one of the most fulfilling and rewarding things I've done in my 30-year career as a learning disability nurse. I strongly encourage all potential nurse innovators and providers out there to consider the potential benefits of investing a relatively small amount of money in undertaking a Queen's Nursing Institute Innovation Award. This project has helped identify signs of an unsafe swallow, ensure people receive the right assessment and treatment, that risks are reduced, and that fewer people are admitted to hospital with aspiration pneumonia, reducing the cost burden to the NHS and the distress and discomfort caused to people with learning disabilities, their families and carers, and the wider community. This was very much a collaborative project. I'd like to give an opportunity for some of the other people involved to say what it meant to them.
Gerard asked me to be a part of the Unsafe Swallow project in order to advise on parts of the project focusing on dysphagia and dysphagia management. There are so many benefits to a project like the Unsafe Swallow project. We know that 15% of individuals with learning disabilities need support to eat and drink, and 8% of people known to learning disability services have dysphagia. However, we also know that dysphagia is often missed in the learning disability population, so this figure is probably much higher in reality. Pneumonia, or aspiration pneumonia, which can be a consequence of dysphagia, accounts for over 40% of deaths in people with learning disabilities, which is much higher than in the general population. This is a health inequality. By upskilling and offering training opportunities to staff teams who support individuals with learning disabilities every day, such as through projects like the Unsafe Swallow project, we are ensuring that staff teams are more confident in identifying dysphagia, more aware of the risks associated with dysphagia, and therefore aware of the importance that people with dysphagia receive the support that they need. It also means that staff teams feel more confident in what they can do to support individuals with eating, drinking and swallowing difficulties, such as ensuring that the person is in an appropriate position at mealtimes, has the right equipment at mealtimes, promoting good quality oral care, and reducing distractions at mealtimes. This means that people with eating, drinking and swallowing difficulties receive the support that they need when they need it from the people who know them best.
When I was approached by Gerard and his team to learn and promote about Unsafe Swallow, I was a little anxious and nervous about doing it. But looking back at the whole experience and the time I have spent learning about this important subject has made me realise how much I have enjoyed myself, and I'm so happy that I decided to join in with this important message of Unsafe Swallow. Thanks for all your time, Robert Cooper.
The Unsafe Swallow training was just fantastic. Some of the team had prior knowledge, some of them, like myself, it was completely new information too. But we all learnt so much from it. This also meant that staff could then move forward and work much more productively with speech and language therapy, which has better outcomes for clients, which is what we want.
My name is Nikki Lyle and I am a learning disability nurse working in the Learning and Development Department at St Anne's Community Services. It was exciting to be involved in the Safe Swallow project, which is an example of collaborative working at its very best. I particularly enjoyed observing Robert as he developed his skills as a co-facilitator, and it was an opportunity to be able to further develop my own knowledge too. The training is designed to be flexible and can be used wherever the person is living at the time, for example in supported living, residential or nursing homes, and can be delivered as a hybrid model. The language used throughout the modules is easily understood with no jargon. This course is an important addition to the training calendar available to our staff, and using the package ensures consistency in delivery throughout the organisation.